Welcome back to the news at 4. We start with the Problem Solvers Health Alert this afternoon as we press on right into Mental Health Awareness Month. The latest report from Colorado's Office of Suicide Prevention, the percentage of students who reported an increase in feeling sad during the pandemic actually rose by nearly 40%. Pretty alarming. And here to discuss it all, Danielle Vice, Director of School-Based Health, Integrated Behavioral Health Services with Denver Health. Thanks for being here, Danielle.
Thank you for having me.
So let's start. What do parents need to know right now? This is alarming.
It absolutely is. I think the main thing is for parents to know that it's really hard to be a teenager, right? There's so much happening in terms of like brain development and physical growth, and it's really hard for kids to sometimes navigate those changes. Especially we know that with the pandemic, or prior to the pandemic, we knew that rates of mental health were increasing in adolescents. That has continued to go up since the pandemic, and a lot of it, right, because of the isolation, the loss, change in routines and uncertainty. We know that it's 5.2 million children globally, and then 200,000 children in the U.S. have lost a parent to COVID-19.
Wow.
Yeah.
Those statistics are just heartbreaking.
Absolutely. Yeah.
And we know that a lot of kids, they were forced to do virtual school away from their friends nonetheless, kind of isolation. What signs should parents out there be looking for when they're worried about their children?
Sure. Absolutely changes in mood, right? So maybe not just like, right, the normal kind of teenagey angst, but something that's more frequent. Also changes in sleep and appetite. Maybe they're not eating or overeating or oversleeping. Any change in academics, truancy. Also, if you're noticing a lot more somatic complaints, so headaches, stomach aches, just general body aches, increased worry, tearfulness, all of those things.
Yeah, and the sadness and depression. If you're a parent and you notice some of these symptoms, how can you support your child?
Yeah, so obviously really want to encourage everyone to talk with their kids every day, right? If you're noticing things, ask them directly about it. Are you feeling depressed? Are you anxious? Are you having suicidal thoughts, right? It's so important to be able to just be upfront and ask them about those things, and be able just to listen without judgment, which can be really hard for parents. I think too, just being able to notice the good things that are happening, right? I think teenagers, there's a lot going on and things can at times maybe be a struggle, but really noticing and pointing out the strengths of your kiddos.
And that's another good question is, if you do see these symptoms and you try to intervene and you really can't, you need some outside help, what resources are available out there?
I would recommend always starting with your pediatrician or primary care provider. At Denver Health, we screen all children and adolescents at most visits for mental health concerns, so it's great to start with your pediatrician or primary care. And then there are, therapy options, ongoing therapy, medication options, all of those things.
Yeah, and it's always okay for parents to look for those signs and ask for help out there.
Absolutely.
Danielle, thanks for being here with Denver Health.
Thank you.